We are anticipating that we are not at the peak yet. The more we distance, the more we stay at home, the farther out that peak happens and the shallower the peak becomes.
A total of 16 cases of coronavirus are now being reported in Midland, 11 in Odessa. That latest in Ector County confirmed late last night. Elsewhere, there are 2 cases in Crane County, 2 in Lee County, and 1 in both Reeves and Martin counties. That brings the total number of cases to 33 in the Permian Basin. And the city of Midland revising their disaster declaration. Businesses must now limit their number of customers and make hand sanitizer available to anyone who visits. Mayor Patrick Payton speaking out about how the economy is being affected because of the virus.
When the nation is beginning to see news that says Midland's going to be the hardest hit city possibly in the entire nation, then that's something else we have to pay attention to as well. So everybody acts like they're really concerned about this region, and then when everything gets back to whatever normal is, they'll start talking about how they hate oil and gas. So quite frankly, I'm not really concerned about what the nation thinks about us. I'm concerned about how we're taking care of each other.
This was the second day for the city of Odessa under the new shelter-in-place order. The city of Odessa working to keep residents informed and safe. Health officials talking about the importance of keeping a safe distance from one another as the best way to avoid the virus.
So that's the important thing to understand, is it's spread by droplets. So if somebody sneezes or coughs and you walk through the whiff of their sneeze or cough, that is the way you would more likely than not get the disease. You can get it from surfaces as well, which is why we talk about cleaning surfaces. But the respiratory is the major way.
This is just a reminder to follow the CDC guidelines everywhere you go. Please keep at least 6 feet between you and other people. Avoid touching your face and constantly wash your hands with soap and water for at least 20 seconds. And be sure to stay tuned right here on Big 2. Medical Center Hospital and Odessa Regional Medical Center will be hosting a joint news conference today at 3 o'clock. Be sure to catch it live right here on Big 2 News. You can also check it out on our website at yourbasin.com. UTPB is doing what they can to help doctors and nurses on the front lines. The university's engineering department is teaming up with the Texas Tech to design new equipment for healthcare workers. They have come up with 2 prototypes for face shields and splitters using the ventilators. Now, Big 2's Jake Eichstad will have more on the story and this effort tonight at 5 o'clock.
The world is understanding a little bit of what we go through every day right now. You know, many of our families, they are quarantined every year during flu season. So they already know what this is like.
That was the development specialist for the Muscular Dystrophy Association of West Texas. They've had to postpone their biggest fundraiser of the year, Fill the Boot, typically raising $100,000 each year in each city. Now, organizers are hoping the event will still happen. And this morning, we introduce you to a Midland family with 2 boys who each have a form of muscular dystrophy. Big 2's Monica Quintero has more on the family's challenges, especially with concerns about the coronavirus.
Their smiles and fun-loving personalities light up a room.
I know how to spell my name.
Meet 5-year-old Traeger and 10-year-old Trenton. The Massey boys have a rare form of muscular dystrophy.
Both the boys have Duchenne muscular dystrophy. It's kind of like a muscle wasting.
Climbing up on something is very difficult, or sometimes getting up from the floor is difficult. Whereas it wasn't always that way. It used to be easier.
Just this school year, Trenton started using a wheelchair to help.
It's hard to walk long distances.
The 4th grader is also taking steroids. Here's a before and after picture. The steroids reduce the amount of muscle loss, as you can see from his picture with the U t-shirt. However, there is a downside.
Trenton is on a steroid that compromises his immune system. So therefore, if he does get the coronavirus, he'll be more susceptible.
As for Jeff, he's grateful to have a job during this difficult time to provide for his family. He works for the nonprofit Breaking Bread, providing meals to the hungry, but the coronavirus has him taking every precaution.
It's definitely stressful because I work with people that already are suffering and in hard places. So now I have to think about protecting what I bring home to my boys.
The Massey family also talked about the importance of MDA of West Texas, which helps 500 families. They've been able to connect with other families in similar situations. Dr. Beck and all the healthcare providers at West Tech Urgent Care are dedicated to fighting this pandemic. And we asked the doctor about the tests that they're offering at 2 locations.
We are doing testing at our office in Odessa, which is 1941 East 37th Street, and then also our North Midland location, which is 3401 Greenbrier. Now, in order to get scheduled for testing, we are asking that you schedule a virtual visit initially, and you can have a face-to-face conversation with a healthcare provider, and we can make the determination whether or not you need to be tested for coronavirus.
Dr. Beck says that you don't even have to leave the comfort of your own home, or own car for that test. You will administer it yourself.
The testing is done at car side. You do not come into the office when you get tested. We go to your car side, we give you the specimen, you swab yourself, and then you put it in the bag, you hand the bag back to us, and then we'll send it off to the lab for testing.
If you have any questions for Dr. Beck, feel free to send them to us. We will share those answers every Wednesday. You can email us at kmidnews@nexstar.tv or message us on Facebook. One NASA astronaut is sharing what it's like to cope with isolation. Colonel Mike Fossum has been to space 3 times, most recently in 2011. He's logged more than 194 hours in space, so he understands isolation.
Kind of settled in. It takes a few weeks, but you settled into a new normal, and I think that's what we're going through right now. What's different is the normal world is right outside our door. It's just not real normal right now with the fear of the pandemic and everything, and those are justified fears.
Colonel Fossum retired from NASA in 2017, and he was part of the expedition 2829. It traveled more than 66 million miles in 167 days. And a Denton mother is waiting for answers about her son who lives in the state facility where the number of COVID-19 cases are growing. The Denton State Supported Living Center now has 50 residents and 23 staff members with COVID-19. Stephanie Kirby's son is a resident with special needs, and she says the information from the top administration is slow and inconsistent.
What I want is more details of the policy, the emergency things being in place.
Kirby says that she's been told the facility is working on setting up a device for FaceTime so she can communicate with her son. Doctors in Fort Worth are using experimental treatment on COVID-19 patients in critical conditions. They've infused blood plasma taken from COVID-19 survivors. The plasma has antibodies that could help patients recover. A Fort Worth patient, a man in his 40s, is on a ventilator at Harris Methodist, and after 2 infusions, doctors say they're hopeful.
It's an individual treatment when everything else has been done that is known to do that is of help. This is an opportunity to offer an experimental treatment that may be of benefit.
Now the FDA has given the green light for other doctors to turn the blood plasma treatments as a last resort, meaning there's now a call for COVID-19 survivors to donate.
Today we reached a historic milestone in our war against the coronavirus. Over 1 million Americans have now been tested, more than any other country by far, not even close, and tested accurately.
More than 4,000 Americans have died from the novel coronavirus, and the death toll higher than 9/11. As the country's first responders treat more and more people, many are accepting a reality that they too will get infected. This as the virus accelerates in the U.S. and abroad, and ABC's Trevor Alt has more.
On the front lines of the fight against COVID-19, EMS workers are becoming overwhelmed.
This is the scariest thing I've ever seen.
In New York City, where 911 calls have skyrocketed, constant contact with potentially sick residents has taken its toll. 1,400 NYPD officers have tested positive, and more than 20% of the EMS force is now out sick, most with COVID-19 or symptoms of the virus. One telling ABC's Eva Pilgrim,
I know we're going to come down with this. At this point, it's not a question of if we are going to get it, but how bad we're going to get it.
And amid growing shortages of personal protective equipment, America's medical workers are under attack.
All the patients in this room, all the feet that you see, they all have COVID.
Dr. Colleen Smith, who shared these dramatic images from Elmhurst Hospital in Queens with ABC News and the New York Times, confirming she's tested positive for COVID-19, describing her symptoms as mild. And the virus continues to bubble up in vulnerable communities. A Southern California nursing home has had more than 50 residents infected. Workers there told to assume all of their patients have contracted the virus. As COVID-19 continues its global assault, Russia now sending the United States planes full of medical masks and equipment, while in the UK, the sharpest spike so far in the country's death toll, more than 500 of their 2,300 deaths coming in the past 24 hours. And France, just starting its third week of lockdown, reporting 499 deaths in the past day.
And while FEMA is coordinating a large response to the crisis, at least one official is calling for better access to crisis counseling. They say as America continues to stay home from fear of physical illness, a mental health crisis is happening as well.